Well, I got Ceann Comhairle, and just I suppose before we get into debating the substantive legislation, this morning I was in my constituency office in Swords, and it's closed at the moment, closed to the public, but we're helping people as much as we can over the phone, and I just some of the stories that we have heard are absolutely heartbreaking. I was a trade union official, most of you know this, for a long time, and I worked with people who lost their jobs, but they generally saw it coming. Even if the boss wouldn't tell you that you were losing your job, you'd know, you'd see there weren't as many customers, you know, they're not as busy as you had been, so you kind of have an inkling. But this has hit people like a freight train, and I won't lie to you, I sobbed my heart out coming in here this morning. And I spent an hour in my constituency office. I don't know how Marion is doing it, or any of our Marions, because they are literally they are dealing with people whose lives are falling apart. And you know, you balance that against the nurses and the doctors and the healthcare workers and the cleaners, and they're putting themselves into a situation where they know it is dangerous, where they know they could get sick, and they're doing it willingly. They're ringing up to come out of retirement. This, in many ways, brings out the best in us. But, you know, it's not enough to say, we hope your landlord won't evict you, because these people have just had every piece of certainty in their life whipped out from under them. So it's not enough to say we hope that there'll be forbearance from the financial institutions. I think we need to give them a little bit more certainty, and I know that that's what people want to do, and I think that that's our work here, because I mean, we're not in the hospitals, we're not in the front line, as it were, of this, but we have to do everything that we can do here as legislators. We have to listen to what people are saying, and when you lose your job, it's absolutely terrifying. When two people in the house lose their job, it's even worse. But if you had the assurance that you couldn't be evicted, that at least, at the very least, when everything else was falling down around your ears, that you could at least think, this house, this place where we live, we can keep it. And I think that's really important work. We need to absolutely do that. And I welcome that there will be legislation tabled, and I think we may have an opportunity here. Ceann Comhairle, I obviously want to pay tribute to the men and women in our health service, every grade, group and category, every single one of them, be it whatever amount of time that they're given. I think that's, you know, that's extremely important. And I think you know, for us, there's other people who are there, like the supermarket shelves are stocked, people can get food, you know, our pharmacies have access to supplies. That's not for nothing, that didn't happen by accident. And, you know, to all of those people as well, I know that they're watching, and they're out there doing that work, and they want to know. And also a special word to the people who are battling misinformation, because that's a tsunami that's coming at us that, you know, I mean, I think when all of this is over, we might meet and consider legislation to deal with. I won't name the particular social media app, but we all know the one I'm talking about, where, you know, the various theories are expounded on, and where virologists who we don't know or ever see apparently go to do some of their best work, you know, where they're not seen in the front line. I think, you know, the people who are trying to combat that misinformation are doing a fantastic job, you know, and that's the only way to beat that, is to have that. Ceann Comhairle, this legislation is absolutely extraordinary, and I suppose the times we're living in are extraordinary to match it. The measures contain some of the greatest constraints on civil liberties ever enacted by this House, potentially. This legislation and the measures to protect the public and public health cannot and must not be abused. Too often, legislation which has been passed here has not been enacted in the manner in which it was intended. And while the legislation will cease on the 9th of May, it does have a built-in extension mechanism, and in that regard I welcome the Minister's words that he is open to discussions about a sunset clause. As I said, the regulations in the bill give extraordinary powers to the Minister to respond to an extraordinary challenge, not least in section 31A, subsection 1, where it allows for restrictions on travel to specified geographical locations, requiring persons to remain in their homes, and the prohibition of certain events in order to prevent, limit, minimise and slow the spread of COVID-19. These powers may very well prove necessary to combat the spread of COVID-19, and it is important that the Minister can react as quickly and effectively as he needs to tackle the spread. As Dr Michael Ryan of the World Health Organization has said, to tackle the coronavirus, we must react quickly and we must be the first movers. We have to be prepared to act speedily. I would, however, urge the Minister always to be cognisant of people's civil liberties when he uses this legislation. Some of these provisions should be measures of last resort and must only be used in the last resort. And we will be watching how it operates, and others will be watching how it operates in practice rather than in theory. I have to raise a point on section 10 of the bill, the insertion of new section 31A subsection 1.1, in that it confers on the Minister any other measures that the Minister considers necessary in order to prevent, limit, minimise or slow the spread of COVID-19. This is an extraordinary measure in that it allows the Minister powers to introduce any measure he wishes in this section by statutory instrument or regulation that does not have to be approved by the Oireachtas. And Count Corlett, we were deliberately sparse in the amendments that we submitted. We were conscious that others would be submitting amendments that we may support, but we deliberately tried to limit that so we wouldn't limit the duplication. But this is a truly extraordinary section. Nobody wants to slow the Minister down in taking fast actions that aren't covered by the list, but it is a point for all of us to be aware of as the days ahead unfold. While we will always seek to hold politicians to account through the Oireachtas, in this instance we do not want to be unnecessarily obstructive given the context and possible urgency and unforeseen issues that may arise. The section which deals with involuntary detention for a person who refuses to self-isolate when they have the virus or with good reason are suspected of having the virus tries to balance the curve of civil liberties with the scale of infectious disease on our doorstep. The legislation should have provided that where a person lacks capacity or a person whose capacity is in question or needs support to understand the implications can have access to an advocate and an advocate be provided for them. I'd like to ask the Minister if provision will be made to ensure that a detainee can have that advocate provided. I'd also like to ask the Minister to use the existing powers for a statutory instrument to be issued to allow for pharmacists to issue repeat prescriptions. This is a very practical step and it will take the pressure off GPs. We need to ensure that this legislation works for the people, not against the people, and that it will have the effect of tackling this deadly virus, and that when we no longer need the additional powers, they can be immediately rescinded.
Thank you very much, Deputy O'Reilly. Now